Hello, my name is Orla Macdonald. I'm a specialist psychiatric pharmacist from Oxford, and today I want to talk to you about a pharmacist's perspective on using digital technology to support patients with mental illness. So first I wanted to introduce myself a little bit. I am a registered pharmacist and I have specialised in psychiatric therapeutics. So I'm an accredited member of the College of Mental Health Pharmacy. And there's actually a network of specialist mental health pharmacists in the UK, and we're represented by the CMHP as a group of pharmacists who have an expert knowledge in mental health medicines. Most of us are based in secondary care and hospital trusts. However, there are some pharmacists who are working from primary care practices, GP surgeries. And collectively, you could say our role is to help patients to optimise medicines when treating mental illness. So since lockdown, pharmacists, as with many other professionals, have had to find new ways of delivering their service, and many of us have turned to digital technology in order to be able to do that. Here are some examples of how colleagues of mine are currently using digital technologies in order to do their job. Whether it's attending multidisciplinary team meetings, for example, ward rounds or CPA meetings, to reviewing medicines or prescribing decisions virtually and having conversations virtually with consultants or second opinion doctors. There are lots of ways we're now working differently using digital technologies to deliver these services. I'm currently working with an early intervention service, and so the majority of patients that get referred to me are outpatients. So I'm going to spend a bit of time talking about how I use digital technology to have consultations with patients for medication review clinics or for medication advice. To start with, I think it's useful for me to talk about the purpose of a pharmacist-led medication review clinic. So as I say, the pharmacist's role is essentially to help that patient optimise the medicine's treatment. We know that a lot of medicines are used in psychiatry, a wide range of medicines, and whilst they can be very effective, they also bring certain complexities to the treatment, such as having to deal with side effects or safety issues that need monitoring. The pharmacist is often seen as an independent expert who can give very specific advice both to patients and to prescribers about how to best use these medicines. When patients are referred to me for medication review or for medicines advice, I think of the purpose of the referral in terms of the principles of medicines optimization, which have been outlined by the Royal Pharmaceutical Society. There could be one or more outcomes that you intend to get from a medication review, and I'll always try to agree with the client in advance or when we start, just to understand what their understanding is, their perspective is of the outcomes that we will achieve during the review. But as I say, I like to think of these outcomes in terms of how they relate to the principles of medicines optimization. So prior to COVID and lockdown, when a client was referred to me, I would usually arrange a face-to-face meeting with a client, usually on the hospital site in one of the rooms in the hospital, but also occasionally in a cafe or in the patient's home. Since lockdown, however, I've been able to continue to offer this service using digital technologies and hosting the consultation using video conferencing. And as I say, there are pharmacists all over the country in a wide variety of medical specialities starting to use the digital technology for consultations like this. And as we're starting to get more used to it, we're starting to see some real advantages to using this technology, especially with clients who have mental health issues, But also there are some barriers that we will need to explore more in order to be able to fully use the digital technologies for these clients. And so in this slide, I've just put down some thoughts about what my experience is of the advantages and also some of the barriers to holding digital consultations in psychiatry. I should say that this is my experience. These are my thoughts. I've not tried to gather thoughts from clients. But as I say, there are some really obvious advantages that have come out of this new way of working. So one of the key advantages is just practically I can be far more flexible and efficient in planning meetings with clients when I don't have to travel to meet them. And the same with clients. They can meet me in their own home or whenever it suits them to sit and have a private conversation. And I've had conversations with clients who've been out for a walk and just being able to be out and in a place that they enjoy being in allows them to be more relaxed and able to kind of think more openly about overcoming barriers to using medicines. Also, given that I'm talking about medicines, it's really nice if I'm able to say to a client, just, take your medicines out there in front of you and we can go through them. We can go through the patient information leaflet. I can look up some really key information in specialist resources that we have, and I can share that information with clients on the screen so we can read through it together. And that's just a really nice way of sharing knowledge in a way that doesn't feel like it's being loaded on top of them and they're having to remember after a meeting. However, obviously there are some barriers that I have come across, and I think in particular it is difficult when clients don't have the right bandwidth, they don't have the right service to be able to hold a really good video consultation. I think it's really interesting that one of the first pieces of advice that pharmacists are given when planning digital consultations is to consider whether video consultation is required or whether the conversation could be had over the telephone. Pharmacists have been given advice about medicines over the telephone for years, and this really isn't new for us. However, in psychiatry, it is often important to have that additional video link, and not just from the purpose of being able to build rapport, build better trust with clients who perhaps feel that they don't know who they're talking to, but also for me to be able to assess objectively how well a client is doing. So when we do a mental state examination, which I would do if I was assessing if a medicine was effective, a lot of what I do is an objective visual observation of how the patient is doing, and I would be looking for side effects, looking for some extrapyramidal side effects you can only really judge by seeing. So it's really important within psychiatry to have that video connection. And therefore, if you don't have a reliable video connection due to bandwidth or whatever, then you can end up having a poorer assessment than you would have had with a face-to-face meeting. Secondly, I've had the experience of where clients just don't like the video technology, and it's because it relates to fears, ideas, thoughts, perhaps ongoing delusional thoughts that they might have about being recorded, and in those cases it just is important to be able to say, right, this technology isn't appropriate here. But overall, I think I can say there are many ways that digital consultations have enhanced the way I can deliver the service and will allow me to make the service more accessible to clients. I think it's fair to say within a short period of time, I've certainly come a long way in being able to use digital technologies to enhance the service that I can offer to clients. It is worth pointing out, though, that there are nuances with using digital technology for consultations that you need to become familiar with and learn about in order to be able to use this technology appropriately. I have found it really helpful to have guidelines that help you to use the digital technologies. And in particular, I would signpost people to the Oxford Health Biomedical Research Centre guidelines on digital consultations. Essentially, these guidelines are a summary of both national and international guidelines on how to carry out digital consultations in mental health. Finally, for pharmacists, there's been recently an article published in the Pharmaceutical Journal about how to carry out digital consultations, and there's other advice from the World Pharmaceutical Society. So there are lots of places to look for advice, and certainly from my experience it has been really helpful to be able to know how to plan these consultations so that you can give the best experience to the clients and get the most out of it in the end. Thank you for listening.